Tuesdays on Humanity Rise.
All right, it's Tech Tuesday, and on the line today, I am joined by John Kamara, Adanian, CEO and founder of AfyaRekod, a health tech platform that's disrupting how health data is managed and bringing power back to the patients and giving them a blockchain-based, secure, universal patient portal. Speaking to us, John joins us on the line. Thank you so much for your time. John, are you well today?
Very well. Thank you very much for having me on.
Great stuff. I mean, this sounds like revolutionary stuff that you are doing. Maybe take us a little bit back and tell us about just your background and, of course, the venture that you are into.
Yeah, thank you. My background is pretty much, I've been in technology most of my life in Europe and also back here in Africa, being an entrepreneur for over 12 years as well.
Yeah.
So worked in that space. But also interacted with healthcare in different value chains. Mm-hmm. But obviously, the biggest thing for me was how do you create a patient at the centerpiece of healthcare?
Yeah.
Because ultimately, the only moving person in healthcare is the patient.
Absolutely.
And healthcare and treatment are supposed to be about the patient.
100%.
So the patient is the last person until something happens. So, which obviously then means the cost of healthcare treatment is really expensive. The efficiency that happens, and ultimately a lot of patients as well don't get what they deserve, and a lot of it then is because of lack of consistency of data.
Yeah. And, I'm always curious about, the catalyst behind an idea. I know, having spoken to many entrepreneurs, sometimes they will say that a lot of these ideas are born out of identifying a personal need or maybe having had an experience yourself. What is your story? What led you down this path?
I think it's a personal story. For me, it's a tragic experience that happened when a friend of mine died because the hospital and the doctors were blindsided to his health record before he got to them.
Goodness.
He would have been around today. So obviously, off the back of that, you start researching and saying, okay, well, it could happen to me as well. And I actually have very little access to my health record as I stand. So why is that? But I pay for it. It's everywhere. It's all over the place. Even hospitals who have electronic health records, they keep it to themselves. Yeah. Why can't I just own it? So that even if I go somewhere, like now I'm in South Africa, I can just, what if I fall sick and just show the doctor, here, this is my record from Kenya.
Yeah. Maybe let's talk now in depth about how exactly your portal works. Take us through it.
Yeah, so basically what we've tried to do is simplify the whole experience, in phase one for the patient. So say, look, we understand that sometimes it's hard for, health facilities and infrastructures to really get into the next wave of technology, but the patient itself is the core driver. So we built a B2C platform called AfyaRekod.com, where a patient can just go sign up like you do a Gmail, nothing major. Once you sign up, we give you X amount of data storage space, and we give you a bunch of tools to allow you to go grab your health record from everywhere.
Yeah.
So the goal is some people live with healthcare and treatment issues every day. So those are the people we focus a lot on. Chronic illness patients, people with hereditary illnesses, and mothers as well who have to track the immunization and everything of their kids through a process. So we give you this platform that allows you to go and do all these things. So you just, you don't have to wait for the hospital anymore. You go and grab your health record yourself. And that means once you're able to store it in one place, you can actually add them, or you can show them, or the next doctor.
Yeah.
And I actually have access to, sort of have a view of my health record before you start prescribing anything for me. Even your prescription information as well. Then we also have diaries in there where you can use to manage yourself. So you can even track the growth of your kids, as a mother.
Yeah.
You can track time. You can set all these monitoring tools, built around AI. But very simple, the way platform works. Behind there's an engine, but in front, we try to simplify it on day one. So we encourage patients. There's also a place for education where you can learn about how to manage treatment. Other patients can talk to you.
Yeah.
You also have communities as well. So we've looked at what a patient needs, the ecosystem. And then we then bring in doctors as well, who also, have interest in talking to patients as well. So they also have a doctor's platform where you can now find and engage with a doctor and do your own teleservice one-on-one with that doctor.
And I was going to ask about, the doctors' part of things, their involvement in your portal, how it was received by them as well. Is it something that they embrace, making perhaps their work that much easier in terms of finding the medical history of their patients? Talk to us a little bit more about those collaborations.
No, it's been interesting. I think a lot of young doctors have been really excited.
Yeah.
About what we're doing. There are resistance from different parts of the industry, which you'd expect.
Of course.
There's nothing wrong with that.
Yeah.
Because traditionally people used to doing things in a certain
way. Correct.
But we're not really saying pure disruption. We're just saying we're adding value to what you're trying to do, because you're still extremely relevant. You're the most, but now we're helping you to provide better efficiency and actually make more money, because you can see more patients quicker and better or more efficiently. And you can actually buy back some time for your family as well. Because you can actually manage the patient remotely through our platform when you also sign up as a doctor. So we're giving you tools to also give you some balance back into your life. As well as generate them more, because doctors get paid the least money.
Sure. And that is the future, right? Embracing technology in terms of making every aspect of your life easier and that much better. Let's talk about the user's experience now. What has been some of the feedback that you are getting in terms of how people are using this portal, this platform?
No, it's been absolutely amazing. I mean, we did a pre-launch in the US with a lot of cancer patients, because again, those chronic patients are so important. They carry files and files around with them every day.
Yeah.
All their data is in one hospital, another hospital, in the email or on WhatsApp or somewhere.
Yeah.
So, they've been very receptive. Even our patient number one, who's South African cancer survivor, laryngectomy survivor, Vanessa, again, having been able to store her record. Now every time she goes to a new hospital here, she's able to show them, she's able to grab it, and then that journey just becomes seamless. So we've had really, really, astonishing first week of results, and more than we actually ever expected. We've gone from 0 to almost 6,000 people.
Yeah. What can you share with us in terms of just how you've been able to grow the portal and maybe also get it out there? Because, as I'm sure you would appreciate, people don't know what they don't know. So are you speaking to maybe medical professionals who are in support of the work that you do to kind of get the word and spread the message out there?
Yeah, no, this particular, because we have the B2B business where we actually provide EHR for hospitals, mobility-based EHR. So that has grown for the past 2 years to almost 50,000 patients across.
Nice.
And we have over 70 or 60 hospitals in that platform.
Nice.
But this B2C specifically, where we're just talking to the patient, has been interesting because we're working with NGOs, we're working with organizations that work. We will work with companies who want to provide wellness platforms for their staff. So we will work with HR. So the world is open once you put the patient at the center.
For sure.
And now we're also working with doctors, where we're providing education and training, and we're going around different cities doing the same thing. So it's a long journey, but the first week of it has been phenomenal.
100%.
So we're really excited about the next 6 months. And obviously our partnership with GE as well has helped us to really promote what we're doing.
Talk to us about whether there are any cost considerations for us to think about AfyaRekod. Tell us if there are, besides maybe costs, other things that we should consider as well.
Yeah, it's myrecord.com. You sign up. There's a basic package where you can just use it for free. But obviously for patients who need more tools and who need more storage and who need more usage and who need more of the services, there is a pro package. It's not too expensive. It's the price of an Uber.
Okay.
So it's the price of an Uber. And there's a premium package where you can use cross-country, even if you're going for medical tourism. As we onboard so many different countries as well. A lot of Africans go to India. A lot of Africans come to South Africa for medical tourism. Again, being able to now access services, because what we do in each city, we also find opportunities for you to get discounts in everything else you do in healthcare. So we onboard pharmacies to give you discounts. Even the hospital will give you discounts on your treatment. All our partners will begin to give you discounts, so you have your own health priority path.
Right. Sure. All the details that perhaps our listener might want to find out, myrecord.com is where you would direct them, yes?
Yes, myrecord.com.
All right, and let's leave it there. Thank you so much, John, for the wonderful work that you do, first of all, but also for availing yourself for this conversation.
No, thank you. It's from Africa to the rest of the world.
Oh, yes. Godspeed. CEO and founder of AfyaRekod, health tech platform that's disrupting how health data is being managed and putting the power back in the hands of patients. So please do visit their website, myrekod.com. That's MYREKOD. That's MYREKOD.com to find out more.
Tech Tuesdays on Humanity Rise.